let me ask you all to respond to this version of the argument, and that is, what Congress is doing is saying that you can't pay for health care with your own money, that you are going to have to pay for it with insurance. That when Michael says you make a rational economic decision not to buy health care, he's talking about an economic choice that is being made by individuals. And that fundamentally, unlike the decision to be a teetotaler, which might be a moral decision or something like that, that the decision not to use insurance but to self-insure is what's being regulated by Congress here. And is that a limiting principle?
No, because they could require you to compel every time you decide not to buy a product, whether it's contraceptives covered by the health care or books in a school curriculum or any other kind of traditional thing we think.
Mike,
well, no, I'm just. But I'll make it a purely economic. If you want to make it purely economic, I will. No, cars are an economic. Or then I don't understand your question.
All right, I apologize. Okay. So you're going to buy health insurance is the premise of the statute, okay. I'll get through 2 sentences. Right, and what, as I take it, the statute is saying is that. No, it's not even one yet. Is that you're going to buy it. Now we're going to tell you how you're going to buy it. You were going to pay for it yourself. Now we're saying that you're going to pay for it this way through insurance, which is different from telling you how it is that you have to buy health care. It's saying when you get health care, you're going to pay for it with insurance rather than on self. Yes, so why isn't that different from saying you have to go buy a car?
I'd rather. My transportation needs are solved by my feet. I've decided to self-move, or a scooter, or a cab, or an airplane. Well, we're just telling you which way you've decided to engage in transportation. It's not a limiting principle. This is the only market that most Americans are going to go into, is that right? Food, clothing, transportation, housing, communications, the labor market. Everyone's going to go into the labor market, so under their theory, they could start regulating college freshmen because it's quite predictable that 95% of them are going to enter the labor market. I can't think of a more constraining, limiting principle on Congress. And if Akhil uses the word interstate one more time, I just want to make 2 points. 95% of guns travel through interstate commerce. That was Lopez. That was about as interstate a market as you could get. That wasn't the theory that it didn't have anything to do with interstate market. It didn't have anything to do with economic activity. And economic inactivity has even less to do with economic activity than the gun purchase in Lopez. And will they defer to Congress on what an interstate market is? They've already held, in Paul's case, Raich, and in Wickard, that growing wheat for your own crops on your own land and having marijuana in your own basement for your own medicinal uses affects the interstate market. And you know what? They were probably right. Because I don't know how you distinguish between homegrown wheat and homegrown marijuana and interstate marijuana. And by the way, it would create enormous enforcement difficulties. So if their limiting principle is rationally establishing a nexus to interstate commerce, we lost that battle in the 1930s when Wickard was decided.
This is why I think your Lopez example backfires, because our point is that Lopez demonstrates the precise limits that in Lopez, the states were separately competent to deal with guns. They can enact any number of regulations that there's no spillover effect when an individual state deals with the gun problem. By contrast, healthcare is one in which when one state does it, it causes interstate spillover effects. Now, if you can tell that story about your transportation markets and your food markets and the like, in which food expenditures are predictable and neighbors don't get stuck the same way with bills they are in the healthcare market, then maybe if Congress can tell that story, that may be something that is constitutional down the road. But
legislative genius to come up with an interstate food market theory. But if I can just try, you started this, Neal, I'm sorry, you started this by saying we're all modeling this after Massachusetts. The Massachusetts miracle, the thing that worked perfectly. So by your own definition, it's not a problem that you can't solve at the state level. You're all holding up, building a cathedral about the Massachusetts.
As Massachusetts itself told the courts, their solution didn't work effectively precisely because it wasn't a national solution.
Precisely because you can't have your cake and eat it too. What you can't do is tell people
Maybe
who
you know more about Massachusetts than they do, but
look, let's see if anyone disagrees with this economic rationale. If fire insurance companies have to insure people after their house is burned down, is that going to raise premiums? Yes. And it's the same thing if you have to insure people who are already sick for health insurance. I'm not saying it's a wrong charitable decision to make, but the notion that that won't drive insurance premiums through the roof is crazy. It's called the Patient Protection and Affordable Care Act. The patient protection was protecting sick people against this discrimination by insurance companies. What made it affordable was conscripting healthy individuals to offset the insurance premiums that the insurance companies suffered because of.
Great, Mike. You don't like the act, vote against it.
It has nothing to do with politics. What it has to do with is your false assertion that this is somehow a unique factual scenario where Congress is never going to be able to cobble together an interstate nexus analogous to this. Every time somebody doesn't pay somebody, costs are shifted. Either the seller absorbs the cost or his other customers absorb the cost. It's not a limiting principle.
Let's talk about
and you're just pretending otherwise because you know there's no limiting principle.
Let's talk about Massachusetts.